Well, good afternoon. Of course, it's been a little over 5 weeks since the last briefing on the 8th of September. And frankly, I think that is too long a gap, but of course it has been caused simply because of the general election. Meanwhile, the virus has continued to escalate across Europe and the UK. The Civil Contingencies Authority did continue to meet throughout the election period, and its final scheduled meeting, as currently constituted, was actually last Friday. The decisions from that meeting flow into today's briefing. And I'd like to just take this opportunity, of course, to thank my colleagues Barry Breo and Mary Lowe, who will step down as deputies at midnight tonight. Not only, of course, for their service in the States generally, but also more particularly for their work as part of the Civil Contingencies Authority during this whole outgoing political term, but of course especially since February this year in the management of the COVID pandemic. Contrary to much social media comment and narrative, the authority has never just taken the advice of Dr. Brink and her public health team. There has always been robust challenge and discussion from all 6 members of the Civil Contingencies Authority, including, of course, representatives from Sark and Alderney, before the policy decisions are made by the politicians, which is where the responsibility lies for those decisions, good or bad. Heidi, of course, has also made it clear that she will not be continuing in her current role as the President of the Committee for Health and Social Care. And I do actually very much hope that whatever role she takes on in the new Assembly, it does actually see her invaluable experience used effectively as we continue through this pandemic. But should this, of course, turn out to be her last briefing, I would like to take this opportunity to thank her for her enormous contribution to the work of not only the Committee of Health and Social Care, but also the authority this year, and not least her steady hand and her advice and support to me in our well, it was daily or sometimes more frequently meetings at the height of the crisis, and of course more recently twice weekly meetings. We have needed to make a political judgment whether to hold this briefing today at all, being the last day of this current term of the States. After tomorrow's election for the President of Policy and Resources, if I cease to be the chair of the CCA, there will be no continuity from the present CCA to the next one. And this would cause at least a 2-week delay in announcing the decisions taken last week to allow the new CCA to be constituted and briefed. I think this is one of those sort of no-win decisions that whichever way we went, it would be criticised, but actually we own the decisions that have been made, and it is our job to explain them. And we also actually felt that the community and business and of course the transport carriers do understandably want and actually need to be able to plan. There was no justification for delaying publication of the information being released today, especially given that that's not happened at any point since this crisis began. I have always promised, all of us always promised to tell you what we know when we know it, and I will honour that to the end of my involvement in the CCA. As you know, we have been planning and resourcing the logistics as well as the testing capability and capacity to enable a move from around the middle of October to Phase 5C. That work has gone very well and pretty much on schedule, subject to some final testing that Paul will talk about, albeit it's cost a little bit more than was originally estimated. So the good news is we are in a position to switch on Phase 5C. But the bad news is that because the prevalence of the virus has gone so high in our main locations of traveller origin, it's actually not going to make any real difference, certainly in the short term, until such time as those prevalence rates do actually start to come down again, which of course they will. In fact, we have made, we had to give some further consideration to precisely what Phase 5C looks like, and Heidi and Nikki are going to take you through that in a moment in some detail, and I don't want to steal their thunder, but I do want to just make a couple of points on Phase 5C and the revisions that we've made to make it. Firstly, testing on arrival remains a key feature which we will now start because we have all the logistics in place to do so. And Nikki will explain the benefits and the advantages of being able to start testing on arrival even if the traveller has to self-isolate for up to 14 days. Secondly, we're bringing in some changes as to how countries and regions are categorised. And thirdly, this revised 5C model does allow for less restricted travel from countries of lower risk. But this is the important point, and it is the important point I want to emphasise. While the model allows for less restricted travel in principle for places that meet the right criteria, and whilst the criteria can be changed by a future CCA, at this current point in time, none of the places where we have direct travel links actually meet those criteria. And it's really important to stress this point to the very many people who are concerned that we may be relaxing our borders at a time that the world around us is seeing cases rising so rapidly. We are not. We are absolutely not doing that. And based on the current prevalence rates, arrivals from the UK, from France, and from Jersey will all need to self-isolate for an absolute minimum of 7 days on arrival here, but in a majority cases right now for 14 days. Phase 5C does not soften our stance on the role of the border in that regard, because it does offer more flexibility moving forward. Because when cases do start to go down elsewhere and are brought under control in our neighbouring countries and regions, at that point 5C allows for less restrictions for travellers. So 5C is a future-proofed as a model to allow travel whilst mitigating until such time as we get to phase 6, which of course you'll recall is unrestricted travel and when that can recommence. So as I say, Nikki and Heidi are going to walk you through the precise detail of how this will all start to work. Paul's going to explain the operational steps taken to prepare for 5C in terms of the infrastructure in place, the technology, including a new online travel tracker, the testing that's taking place that I referred to earlier, as well as safe student repatriation. And I want to just say one or two words about students, particularly to the parents and students of those returning or those that have already returned to the island for half-term breaks or university reading weeks. Statistically, of course, those in that group are probably our highest risk right now. And so please ensure that, that you do adhere to the legally imposed period of self-isolation and the enhanced passive follow-up requirements to which you are subject by law. We do not want any one of you to be the individual responsible for seeding this virus back into our community. Law enforcement and the courts have shown that, quite rightly, there will be no leniency for breaches of the regulations. Second, there have once again been inaccurate social media comments that the regime at Christmas will in some way be softer for students. This is, yet again, absolute, utter nonsense. No proposals, I say again, have been presented to, discussed by, or decided by the CCA so far. The only thing that's happened so far, the only thing that's taking place is the Committee for Education, Sport and Culture have leading a survey of those students and trying really to ascertain if there's actually any merit, for example, in arranging special flights or ferries. Not least, so actually those students who do come back at Christmas can actually travel together as a cohort rather than with other individuals who may possibly be at higher risk. And whilst referencing social media, it's also worth noting that there are often hurtful comments targeted at groups outside the island, whether they're students or those in the UK or Jersey. Please bear in mind that many in our community have friends and family who are in those groups. And whilst we of course can all enjoy our own bailiwick's fortunate position, it would, I'm afraid, be hubris to gloat, and it can be very painful to those who feel targeted by those comments. I know that because those comments are often forwarded on to me. Finally, from me, I want to report some positive economic news. Our central forecast is for a 6.4% contraction in the economy this year, with growth of 4.8% next year. The actual outcome could, of course, be either better or worse than that. By way of comparison, Jersey's latest central forecast are for a contraction of 7.5% this year, and with 3% growth next year. Our current forecast for the public finances for 2020 is a COVID cost of 136 million, as against an estimate of 173 million in May. So that's an improvement of 37 million. And I'm also very happy to be able to report some breaking news on unemployment figures, which have kindly been provided to me today by another outgoing colleague and President of the Committee for Employment and Social Security, Deputy Michel Leclerc, showing another big drop in unemployment figures. They fell by more than 100 in September to 570, which takes unemployment to 1.8% of the working population, which of course is very close to our pre-COVID levels. And I think that what that tells us is what we already knew, that it isn't a choice between public health and the economy. They're not mutually exclusive. If we make the right decisions and get the public health bit right and under control, which of course we have up to now anyway, the economic damage is less. From a health, social and economic perspective, we are, as we know, in a very, very good position compared to so many jurisdictions. And all the more so, of course, that we continue to be able to avoid non-pharmaceutical interventions such as social distancing and face masks, which, of course, further helps confidence and the economy. And, of course, long may this continue. Finally, I hope that I am re-elected tomorrow to my role, and I will be here for the next briefing. But in case I'm not, I will take this opportunity to wish you all well, to thank you for all your support, and most especially important, of course, to thank the whole of the public service, and in fact the whole of Team Guernsey, for delivering the quite remarkable outcomes from Guernsey Together. So thank you very much from me, and Nikki and Heidi.
Thank you, Gavin. Yes, we're back by popular demand. Nikki and I are going to go through what Phase 5C looks like, or should I say Dr. Nicola Brink, MBE. And congratulations. Now, this is different from the overview we gave you over a month ago, and that's because we've seen prevalence rates rise all around us, as Gavin just pointed out. It's important then, therefore, that we move forward in a safe and measured way, and taking that into account, we've developed a revised Phase C. Now, the changes mean that we have a system we can keep in place for the foreseeable future, with self-isolation requirements changing with the prevalence levels as they move up or down. And I think Nikki will be talking about the prevalence levels now.
So thank you very much. And this shows our prevalence map using data that we extract primarily from the ECDC website. That's the European Centre for Disease Prevention and Control. And we look at this on a daily basis. So around about 11:30, we extract all the data, and then we collate that into a table, which we look at about 12 o'clock each day, and we use for our regional classification. We use 7 days, and we look at the prevalence rates over a 7-day period to ascertain what group the country should belong to. Now, what you can see from this map is you can essentially see that most of the, or almost all the regions in the UK are now above 100 per 100,000. The only exceptions are a few regions in Scotland. The rest are all well above 100 per 100,000. And if you look at the north of England, the northeast and northwest, the prevalence there is above 550 per 100,000. Lower prevalences are seen in the south of England, but still the southeast and southwest are now both above 100 per 100,000 as well. So this provides us the data to inform our decision making, and as I say, we look at it on a daily basis to ensure that it is completely up to date. And I'm going to pass back to Heidi now to go through the new categorization which we're looking at.
Thanks, Nikki. So Phase 5C sees a change from having Group A and B countries and regions to categories 1, 2, 3 and 4. Now, we did think about keeping the same letter system, but we thought redefining the terms would cause confusion. So that's why we've introduced these new categories, and I'll just go through what they are now. Category 1, this is the air bridge. This is what we've got with the Isle of Man. Really no change, no testing required on arrival, no self-isolation. Everything's great. When we get to category 2, 3 and 4, this is where we're introducing testing on arrival. Now, the advantage of this is that we can reduce the self-isolation periods, as we'll be able to begin contact tracing more quickly. And there are also other benefits as well. I think, Nikki, you can talk more about that testing on arrival.
So with the testing of arrival, we're looking for a number of things. The first is we want to see if someone is positive on arrival so that we can do the appropriate contact tracing. Now, the testing on arrival and testing on day 7 gives us a really good balance. So if someone tests positive on arrival, we know that the people in the plane, for example, are contacts and we need to follow them up appropriately. If someone tests negative on arrival but positive on day 7, we know that they then acquired their infection either during travel or just before travel. Just to remind you, the incubation of the period of the virus being 2 to 14 days. So if someone's negative on the day of arrival but positive on day 7, we don't need to then contact trace the plane. I think the other important thing about the early diagnosis of infection, what is very clear is that the prompt appropriate management of COVID-19 is really important as well. So if we look at people who get sicker, early use of oxygen, early use of dexamethasone is really important in improving people's prognosis. So we want to define who's infected so we can do the appropriate contact tracing, but also so that we can provide the appropriate health and care to the person who has COVID-19. So it's a balance between the two.
So thanks, Nikki. So just continuing on category 2, this is for areas where they have less than 30 per 100,000 prevalence rate. So that's just one step above where we are from category 1. But there's testing on arrival and testing on day 7. But the difference here is that if you're self-isolate, you only have to self-isolate until you've got the results of that day 1 test. And if it's negative, then you can go into what's called enhanced passive follow-up until day 7, and then passive follow-up. And Nikki at the end will describe and explain the difference between enhanced passive follow-up and passive follow-up. So that leads us to category 3 for prevalence rates between 30 to 100 per 100,000 for 7 consecutive days. Again, testing on arrival and testing on day 7. The difference here is that self-isolation, you have to self-isolate until the day 7 test. So just a bit like coming from a Group B country now, the only difference being that you've got testing on arrival as well. And then we expect, if it's negative, to have enhanced passive follow-up for up until day 14. And that then leads us to category 4, which is basically what we'd say, well, our Group A countries are now, it's where prevalence is over 100 per 100,000, just a test on arrival, and then straightforward self-isolation for 14 days.
So I'm going to take you through enhanced passive follow-up versus what we'd call our current passive follow-up. And there are 2 points that I think are absolutely important here. The first is we know that about 94% of cases will be detected if you test them on day 7. So that's helped inform what sort of policy we should have in place. The second is, as always, we're trying to balance the restrictions we place on an individual versus the restrictions we place on a community. And trying to find that right balance is sometimes difficult. However, key consideration here is we exist in a community with no NPRs, no non-pharmaceutical interventions, as Deputy St. Pierre said. So no social distancing, no masks, no gathering size limits, and all of that. People can sing, they can go to concerts, so we have an unrestricted society. So trying to balance what restrictions we should put on a traveller and what restrictions we should put on the community is always difficult. So we developed this enhanced passive follow-up, and basically that tries to look at the riskiest times of infections and the riskiest prevalence of infections and put some more restrictive measures on returning travellers, but at the same time trying not to put in any additional measures on the community. And the whole focus is to keep everyone safe. So, for example, one of the things that people said to us a lot in self-isolation is it's being confined for that 2-week period. They find that difficult, and I can quite understand that. So with regard to exercise and enhanced passive follow-up, there's absolutely no limit to outdoor exercise. You can go out as long as you maintain a social distance, absolutely no limit at all. You can go out to do some essential shopping, but you're encouraged to try and limit that, and that's really important. People also spoke to us about connectivity during periods of self-isolation, and again, in designing the enhanced passive follow-up, we took that into account. So we said within enhanced passive follow-up, people can meet in gatherings of 10 or less. And again, that enables people to see their family, retain their connections and so on. But I think, again, when you attend and see other people, you need to consider those persons' vulnerability. So really important that people take this into consideration. Mustn't use general public transport, that's really important. And then going on from that, as always, if someone becomes symptomatic, they should seek appropriate advice as to see whether they should be tested or not. Health and care premises is really important again, and there's lots of similarity in our normal passive follow-up. We'd ask people not to go to residential and care homes and hospitals unless they have a specific reason, unless it's an emergency. On top of that, also to aid any contact tracing that we might have to do, we ask people to keep a record of all of their contacts. So again, really important. And just to remind you, if we get a positive case, is we try and start contact tracing within an hour of getting the positive result. And that was absolutely pivotal in our success in the first wave, is that very timely, very quick contact tracing. So I think that's important. With regard to work, if someone doesn't have a public-facing role, they can return to work as long as it has been specifically risk assessed by their company, by their work, to ensure that it doesn't pose an unnecessary risk to other members of that work community. And obviously, if it's a public-facing role, we would say that that would not be appropriate. So, any other additional restrictions? There are unpredicted things that come up from time to time that we have to then put on additional restriction. I can only remember once or twice that we've had to do it when we've explained it. People have been enormously cooperative with regard to that. Again, visiting during that time, limit your number of visitors, but you still can see people. Education of children is during the period of enhanced passive follow-up. We've said that children cannot attend educational settings. That's because of the impact on the rest of the children. Should one of these children come up positive, even if you were in a bubble system within classrooms, it would mean that an entire bubble, or indeed, worst case scenario, a whole school might have to be sent home. So as always, we're trying to balance the needs of an individual versus the needs of the community that they exist in. And for people in enhanced passive follow-up, we strongly recommend that they wear face masks when they're out in the community in closed areas. So that's really important. And of course, practice social distancing. So,
thanks, Nikki.
Carry on.
I'd just like to reiterate what Gavin said earlier, that those concerned about the rising prevalence rates in the UK, France and Jersey should not see this move as less safe than the current travel restrictions. Based on the current prevalence levels, all arrivals will still need to self-isolate for either 7 or 14 days. The testing on arrival, though, just adds a further tool in our test, track and trace programme, which has been extremely effective to date. Now, the CCA intends to move into this amended Phase C shortly. Final dry run testing is currently underway, and I think Paul will speak more about that in a minute. And the intention is to formally introduce the new Phase 5C arrangements on Monday, 26th of October. I'd just like to mention briefly about, I don't know if everybody's seen already today, that today is Global Hand Washing Day. That doesn't mean that today is the only day that you're allowed to wash your hands, but it's really to raise awareness about the importance of hand washing as an effective way to reduce the spread of germs and to stay healthy. And we thought it would be a great day to launch our Guernsey Together Winter 2020 campaign, which is called Working Together to Stay Well. And I think we've got it on one of the slides, on one of the banners here. So what we're doing, we're kicking it off with a pop-up hand washing station at Admiral Park at Waitrose there, where you can see how well you wash your hands using an ultraviolet light. And we've got public health staff there who will be happy to talk to you about other ways that we can keep ourselves, our friends and families well this winter, such as getting a flu jab if you can, respecting personal space and looking after yourself physically and mentally. Now, the campaign will continue through the coming months to remind us all about what we can do to keep well, prevent the spread of infection and keep the pressure off our health services. And finally, and on that, I'd just like to say what an honour and privilege it has been for me to serve as HSC President, representing thousands of people doing jobs I couldn't do and doing them so well. And we've all seen that over the last few months. There are some amazing people I've worked with, and I wish them all and the new committee good luck for the future. Thank you.
Before we hand over to Paul, I just wanted to emphasise keep emphasising this point because I don't want to get lost. Nikki, you've gone through the enhanced passive follow-up in quite a lot of detail, understandably, because there is a lot of information there. But emphasising once again that this will actually have very little practical application in the short term because of where prevalence rates are. There are only a few that will be subject to this, but we need everybody to start becoming familiar with this. As prevalence rates change, then this will start to have more relevance, but it really isn't terribly practical at the moment for most people. That's correct.
Absolutely not. So it'll only work when the prevalence rates come down. But again, we felt that it was important to set an infrastructure in place that could future-proof and look towards the next few months and give us some security with regard to that.
Great, thank you very much. Paul.
Thank you. The practical work to move us to the next phase of exit from lockdown, as approved by the Civil Contingencies Authority and set out by the panel, has been progressing steadily. As circumstances have changed, our planning has had to adapt accordingly. Whilst we are watching and monitoring the developments of our neighbours and protecting the borders accordingly, it's very important that we keep preparations moving forward. As mentioned, there will be a time when the prevalence of COVID-19 in our neighbouring jurisdictions will begin to drop once more, and we must be ready to facilitate increased movement through our borders safely and as soon as it becomes possible to do so. It is the balance of restrictions on our borders that allow the freedoms we enjoy here in the bailiwick, and it is the agile nature of our operational planning that has allowed us to manage that balance. At all times, we consider the impacts not only on our community's physical health, but also its mental and economic health. As previously mentioned, any risk taken is not simply about specific groups or individuals, but taken on behalf of the whole community. Preparations for the introduction of a test on arrival for the majority of passengers as a revised Phase C has required a significant amount of operational planning. It has not simply been about commissioning of the testing kit, but also the introduction of a new website, the travel tracker, and digital solution that will make it easier for us to capture information and understand the movement of passengers, where they are arriving from, their testing frequency, and results that enable us to track their contacts should we need to do so. Importantly, this digital capability is being designed not only for these immediate changes, but also to allow us to move swiftly as the circumstances will undoubtedly change. We are now in the final stages of testing and dry running all these systems with the aim of launching on Monday the 26th of October. Although I make no apologies for the fact that our system testing and staff training is thorough as we move only to the next phase when it is safe to do so. If you haven't had reason to travel recently, you may not be aware of the significant structural changes at the airport and at the harbour temporarily to built accommodation for testing upon arrival. And we've also been training our staff who will operate at the ports. So when the test upon arrival commences, and when in the future passenger movements do increase, we can move people in and out of the arrival halls with as little waiting time and inconvenience as possible. We are very mindful of those islanders who are separated from their friends and families and find the travel restrictions prohibitive because of the necessity to isolate and make all efforts to mitigate and keep travel safe, including the regional approach to area categorization. We do not take our precautions lightly. However, it is the management of our borders that is our best line of defence and is allowing us to live without restrictions, and by doing so support our economy, our local businesses and tradespeople to operate, and overall protecting the mental health and well-being of our broader community. This is vital because we must ensure the sustainability of our economy post-COVID-19, and the livelihood of our island families depends on it. Our hospitality sector continues to be one of the hardest hit, and following liaison with industry representatives, the sector remains eligible for financial support either through the payroll scheme or through a new grant system. This was launched yesterday and all details are available online. These measures aim to protect the industry so that they can resume trading more normally at some point in 2021. Our hospitality sector is dependent upon us protecting the health of our community and will be severely damaged if we were to head into a broader community restrictive measures ahead of the festive period. Initiatives like Staycation campaign and the Tennerfest that great numbers have been and continue to enjoy are dependent on us being able to meet and socialise without restrictions. As noted by Deputy St Pierre, this week we have been contacting our university students who are studying off island so that we can understand their hopes, intentions and plans for their homecoming and return for the Christmas holidays. There has been a number of concerns raised about how this will be managed, particularly with the increased infection rates that have been seen on many campuses. This work is ongoing, but please be assured within education they have set up a dedicated project team and are working on these issues in detail. It isn't quite as obvious as it would appear that 500 students will all return in the same fortnight period. Clearly there is a different flow and different issues in regarding our students, so we're having to unpack that before we can provide further information. And lastly, as Deputy Salisbury has mentioned, today we are launching our winter health campaign, kicking off with the Global Hand Washing Day. We remain in this together as a community, as we all feel this has become a marathon rather than a sprint. It has never been more important to sustain that. Please do all you can to support each other to keep fit and healthy this winter. If you need advice, please contact our helplines that continue to operate 5 days a week. And if you're unwell, please stay at home.
Great, thank you very much indeed. So we'll throw it open to questions. Who wants to go first? Yes.
Maisie Foot, Bailiwick Express. How can you be sure that people in enhanced passive follow-up are following the rules?
It's probably one for Nikki and Paul between them in terms of the operational issues of how you adhere to that or ensure adherence. Nikki, do you want to start?
So thank you for that, and that is something that we've considered in detail. It will be legally enforceable, and so just like people declare the areas that they've travelled to, is they will be required to stay in enhanced passive follow-up, and it will be legally enforceable. So there will be a way of monitoring it, and I think it's important that people are aware that this is not a request, this is something that will be required of them in when they return. And I think, as I said before, it's always going to be a balance between what restrictions we put on the community and what restrictions we put on the traveller, and the balance is always difficult.
So, yeah, so the key thing really is that unlike other jurisdictions, it's not guidance, it is in regulation. So, yes, Marie.
Marina Jenkins, ITV News. Just following on from that then, in terms of this monitoring, how kind of equipped is kind of law enforcement, border control able to deal with this? Should the numbers kind of increase and people coming back towards Christmas? Kind of how equipped are they, and what kind of pressure will that add to?
Cool.
Yeah, I think in part of that, just add to what's already been said. Obviously, the digital solution we talked about, the travel tracker, is really key to being able to work with a higher volume and the increased movement and the test on arrival. So that allows then the law enforcement teams to have first-hand information and be able to follow through on the checks that are made and be able to resource against that.
Okay, yep, next question.
Danielle Keneally, Guernsey Press. Is there any indication of the cost of the testing regime, and will it remain free for travellers?
I'll perhaps deal with that. I mean, there are significant costs associated with introducing the testing regime, which I think were identified some months ago. The view of Civil Contingencies Authority and Policy and Resources is that actually we need to get the scheme up and running and motoring, and that everybody knows it's working properly before you start to think about the imposition of charges for that. So the reality is we're still quite a long way off from being able to make that decision, because even though testing can be turned on in the way that we've talked about in a couple of weeks' time, the reality is most people will be tested and then go straight into self-isolation. So at least for the time being, until prevalence rates change. So I think, I mean, clearly it will be a decision for a different and a future group of politicians in whatever format. But that's the position that, as we leave it, as we leave this term of government.
Yeah, I just think that's absolutely right. We've talked about actually moving towards test and arrival, and the fact that we want to get this right. We've but the human resource capabilities we've talked about at the borders. It's a real cross-disciplinary teams that will be available at the ports, and also, as you've suggested earlier on, about the law enforcement in terms of following up. But I think that's great while we're in this current prevalence levels, so the movement of people isn't changing considerably, but will be a consideration once we get, for example, to category 2.
Yep.
Ewan Duncan from BBC Guernsey. Question for you, Dr. Brick. I know that you obviously look at the evidence quite a lot. From early press conferences, you were saying we were likely to pick up cases about day 5, day 6. What's the current evidence? And I appreciate you might not have a lot of evidence in Guernsey, statistical data, but from cases that have been tested fairly early on, coming to Ireland day 1, say, what's the amount of cases you're finding on day 7, positive cases?
So since we introduced our programme on the 17th of August, we've had 6 cases that we've detected. 1 was symptomatic, and in fact 2 were symptomatic, 4 were picked up on the day 7 testing. So a combination of the both. During that time, we've had probably just under 3,000 travellers, so round about that sort of level. So I think that gives you some idea of the number we'd expect to pick up. Testing on the day of arrival will detect people who've been infected more than 2 days prior to travel. Testing after that will detect people who are infected within 2 days of travelling and infected during the travel process. So the two-pronged approach of the testing on day of arrival and testing on day 7 gives us a secure approach, or as secure as we can be approach, to ensuring the safety of our population.
Just to add to that, because we're not picking up what the actual all the numbers of people who might be positive are, because a lot of people are coming from regions in Group A where they're just going straight into 14-day self-isolation without any tests. But what we're doing now, we will be picking them up as they will be tested on arrival.
So that just emphasised that's one of the key advantages of being able to introduce testing on arrival. Particularly, again, as we think about heading into the Christmas period with students coming home, we know that students, Nikki, correct me if I'm wrong, but a lot of them, to the extent they do have it, may well be asymptomatic. So at the moment, we effectively under-reporting our awareness of COVID in that community, because as Heidi says, they're coming straight in, they're going into 14 days isolation, they're emerging at the end of it, and we've never known that actually they may have had it whilst they were, albeit asymptomatically, whilst they were in self-isolation. Having that kind of access to that kind of information, of course, is really important for future planning decisions, future policy decisions. So that is one of the advantages of why we want to turn on testing on arrival, even though it's not really going to change the traveller experience for some time.
And I think there's a further enhancement from the testing on arrival, because if someone becomes symptomatic that was a traveller on an aircraft, then you then have to do the track and trace around a large majority of the passengers around them, where obviously if we're collecting the data of the tested arrival of everybody, it limits the amount of testing or track and tracing that has to be done, and then people being inconvenienced to have to then go on to a self-isolation regime because of that. So there are further other additional enhancements.
Good point. Next question. Yep.
Deputy St Pierre, you mentioned that the CCA, of course, will be changing in the next week or so. How will that affect things? Can we still expect continuity with the current plans that are in place?
Yeah, actually, Nikki, can you go back to the category 2, 3 on here? Yeah, if we stick on, we'll stick on 2, and I'll just walk you through again the different categories. The key decision here, in terms of for the authority, now that if you like, the regime is set, is that first box on the left-hand side called prevalence. So it's less than 30 and 100,000. If we go on to the next one, Nikki, it's between 30 and 100, and then category 4 is over 100. Now clearly, effectively, the authority can decide to dial up or dial down its appetite for risk by changing that number. So the rest of the regime doesn't really need to change. That's the key political decision. So, you know, in terms of where that will go in the future, I mean, clearly that will be a decision for the future authority. And as we've said, it will, of course, by definition, have at least 3 new members as a result of the election. The Alderney and the SARC representatives will, of course, stay the same. So they have, and of course, will have their own concerns in relation to protecting their own communities, which, of course, is fed into the decisions of the authority. But I think the rest of it is now, and that's partly the reason when we talk about future-proofing, we're future-proofing the structure of how this works for travel until we get to phase 6. But the political decision is around those prevalence levels, obviously informed by public health. I mean, certainly our consideration has been over understanding what the level of risk is of travellers getting into the community, and there's a huge amount of data presented to us by the authority that enabled this authority to set the prevalence levels at the level we have. Yeah, and again, Nikki's job is to advise the authority, well, actually, if that number on that slide were 250 in 100,000 or 300 in 100,000, what does that mean in terms of the number of travellers who would end up being in the community with the infection? So that's where the decision lies.
Yeah, we've had some really amazing quality data that we can work with, but at the end of the day, there's also probabilities, so you can't ever know for certain what's going to happen, but we have to look at those probabilities, various scenarios, and then decide for ourselves what we think is an acceptable risk, and also the risk that the public will understand and accept as well, because it is, as we always said, it is Guernsey together, and it's about everybody understanding and kind of relating to what we're trying to do. I think if we'd said, right, well, let's move prevalence levels far higher, I think it would have been caused some concern. This is very much flows on from what we were doing with before and with our Group A and Group B countries.
Yeah, and 5B, yeah. Next question, sorry, yeah, Marina, and then you.
Why have you decided to recategorise it 1, 2, 3, 4 instead of sticking with A, B, C and adding a D?
Well, I think as I said when I spoke earlier, there is a lot of confusion. There has been confusion in other jurisdictions. I think in the UK they've had different colours and they've had different tiers and they've had different regions. But we thought if we changed Group A, B and C, because there would be changes, then that would also cause confusion. So we thought it's best just to start afresh with different categories, so people don't think, well, I thought Group A was this, but now it's that. It's easier to have a clean set of new categories. And as I say, this is something that we see that we can keep for the foreseeable future, and it's the prevalence levels, and what will change is that prevalence levels which Gavin's just described.
And once again, really important that this has been designed and the languages have been used to recognise the bailiwick's own requirements rather than, again, mimicking what others are doing elsewhere. And so you're talking about levels and all of these things which and tiers which we're now hearing, it doesn't particularly help if people can't, if they get confused between what's happening in one jurisdiction and another. So you know, that's taken some thought as well to try and present it in a way which is clear that this is about Guernsey, this is about Guernsey's requirements, setting it in the context that we are very unique in operating in an environment with no pharmaceutical interventions. Yes, Ewan.
Dr. Brink, a question about transit travel. We see in the UK that lots of areas are doing much worse than other areas. You know, if you look at Scotland, for example, the central belt, very bad, but the further north you go, a bit better. The way that Guernsey classifies it could put the whole of the north in a completely different category from what we classify in the UK. But even still, if we look at, say, Southampton, Poole, that area, we have to sort of accept that the majority of people travelling to Guernsey are going to come through those ports. If, for example, they continue to do well or got worse than the other areas people were transiting through, that would impact their length of time that they were asked to self-isolate for. Is there going to be some consideration to travellers, say they're travelling through Southampton Airport, saying, well, okay, we're taking the risk that you're going through an airport, you're going to be socially distancing, you're going to wear your mask, that kind of thing, to, you know, if you came from a jurisdiction which was doing better than, say, Southampton?
I think having the two-tiered testing approach of testing on the day of arrival and testing on day 7 eventually, but certainly testing on the day of arrival is going to give us far better information. We know that people don't just get down to an airport, they have to get down to the airport somehow. It might be on a train, the train may be crowded or not, there may be varying compliance to social distancing, ill people travelling, wearing masks and so on. So it's quite difficult to provide precise guidance with regard to saying, well, fine, if you've travelled through that area, it's okay. Or if this area has now worsened. So if Southampton were to worsen as an area, we would clearly have to look at our travel links and look at what mitigations we could put in place. And one of the reasons why we did these categories is that they've given us a framework, but we can always then look, if we have specific requirements, as how we meet those as an island. So we've always said that we will continually adapt and be flexible. That's formed part of what we've done from the beginning. So I think that's probably the best answer I can give you at the moment.
Okay, yes.
I know you said that there's still a lot of work ongoing with regards to students coming home for Christmas, but I wanted to ask what options would be considered. Would perhaps quarantine hotels be one of them, or something similar?
Again, I really don't want to speculate. I don't think it's terribly helpful. So what we recognise is that there is an issue there. Clearly, families will want to reconnect at Christmas. We've also got to recognise the reality that many of them are coming from environments where there are high prevalence rates and student communities where is one of the higher risk zones at the moment. So I think it's working out how we can get individuals back here if they want to reconnect with their family. I think we have to recognise that reality, but also emphasising again that there can't be any softer options in terms of the risk to the community. So it is about how we mitigate the risk of those students returning and protect the community, while still facilitating the ability for people to reconnect at a very important time of the year. So, emphasising, as I said earlier, there have been no presentation yet of ideas from the public health team working with Paul and his team. So, at some point, the authority would expect to receive some recommendations, which would then get kicked around by the authority for a decision to be made. But none of that has come forward yet. And I think, other than giving the reassurance that as a government, we know there is an issue there that needs to be addressed, I think further speculation probably isn't in anyone's interests right now. I'm going to go to Rob, actually, because you've got a question from somebody who's not here, I think.
That's right. We have a question submitted in writing from Island FM, who couldn't make it in person. So they have asked if we could put to the panel on their behalf this question. Are any discussions being had about the approach to Jersey, currently requiring 14 days self-isolation because of their case numbers? Is there scope to agree an alternative arrangement based on their testing rate, their own moves to extend isolation for incoming visitors, and their contact tracing app?
Paul, in terms of your contact with your opposite number, and perhaps Nikki can talk about contact with her opposite number. I mean, I think the big picture remains that this is the structure that we're setting for travel from whichever jurisdiction, and we've got the right screen in front of us now. At the moment, Jersey is sitting, I think, at about 60, 66, 68 per 100,000. So it's sitting in category 3. So at the moment, it would be test on arrival and test on day 7, but self-isolation in the meantime. In terms of a variation from that, again, I'm not aware of any suggestion or discussion that we would be doing something different for Jersey. Because of what's going on there. But Paul and Nikki, perhaps you could just add to that.
Yeah, I wouldn't add much more than what's already been covered, other than to say that we are, as we are with all the other jurisdictions, currently looking at what options, what opportunities there are, and clearly the change in prevalence levels, including, as we've seen quite recently, quite a rapid increase in Jersey, means we have to pause and reflect on what that means and build that into our system, which is now why we've got this particular category structure to be able to operate from.
Yeah, just because it's near to us doesn't mean that we should treat it any differently, and it fits fairly and squarely into category 3.
Nikki?
Yeah, just to say we continually review all of the data from all of the jurisdictions, and we're in consultation with our colleagues in Jersey, and we'll continue to have those discussions. And I think it's important that we have some sort of standardised approach that we can present to our community in Guernsey. And if we deviate from that, again, as we have always done, we then give our community the reasons why we are recommending a deviation from any policy. And I think that communication, having a standard approach, being flexible, but also communicating any variations is really important. And we would intend to do that under these circumstances as well.
Okay, thank you. Marina, then Ewan.
Considering an app, would that be beneficial to the process, or are there not enough people travelling to the island to kind of make it viable?
Vicky, I think.
I can take that. So we would always consider an app if the prevalence was high enough. So apps work really well in areas where you've got a high prevalence of infection. We thankfully have an extremely low prevalence of infection in Guernsey, so we keep an open mind with regard to apps. Should we feel one is indicated for our community, we would of course look at one, but really apps focus on a high prevalence situation. And I think the other important thing is, if you look at the efficacy of contact tracing, in the first wave, we were able to contact more than 90% of contacts. So the efficacy of our contact tracing is really high. So if we were to use an app, we would want to see that augmented this and improved it, and it would be in a higher prevalence situation. Where we are recommending apps is for people, if they travel to other jurisdictions, we're saying it's very sensible to download the app of that jurisdiction. So if there are any contacts, we can then help them sort that out. So we're saying to people, if you download them, if your app does notify and it's unclear what you should be doing, we're very happy to then contact Public Health England and so on your behalf. So we've been doing that for several people who've already contacted us. So I think that's really important. Sorry, Heidi.
Yes, sorry, Nikki. I was just going to say that the public health team are looking at all the apps out there. It's not as if we're saying, oh, we don't need to worry about them because our prevalence rates are low. They are looking and saying which ones are good, which ones work, in the event that we might need to have an app ourselves.
Yeah, we continually review it, and if we need to have an app, we'll get an app.
And we have been in that process really almost since
from the beginning.
I think that's really key, because I did a rough thought on this the other day and thought we'd probably be on about our 6th app now that have proved not to be very efficient, and we'd have spent an awful lot of money. I think we've dedicated our funding where we've needed to, but I think one of the key points made by Dr. Brink is the apps are really successful where you have high density, high population areas, and obviously high prevalence within there, and actually that sort of 30 to 40% success rate does have a positive outcome in those particular circumstances. But our track and trace is already giving us over 90% with a low population, low prevalence jurisdiction. So I think we're probably where we are, but as Deputy Salisbury says, we're always seeing if there's a product that suddenly is the one that we need to really invest in.
Okay. Yeah.
Question again for Dr. Brink. I know Deputy St Pierre has touched on it as well, and the fact that the numbers could go up and down for the certain categories. But what will you need to see from neighbouring jurisdictions or from the results you get from our ports to determine a move up or a move down of those scales?
So we don't use our port data. We use extracted prevalence data from, as I say, primarily from ECDC, the European Centre for Disease Prevention and Control, and they collate data nationally. The data comes onto their website in the first part of the morning. We usually look at it about 11 o'clock and we extract that data, and that means that we've got an overall country prevalence. Now, interestingly, with that data, they don't only consider the prevalence of infection, but they also consider testing rates, because as we've said on so many occasions before, if you don't test, you're not going to get anything, are you? They also look at test positivity as well. So there are a number of things they look at, and we use all of those to put into our database. So we have an AI database that we extract the data in, and we look at it on a daily basis. So we're taken to account any positivity we got at our ports and our airport and harbours. That's really important, but we'll then backtrack that information onto the national prevalence data that's being published, but we'd also then forward track it onto what are we seeing in primary care. Are we getting any reports of COVID-like symptoms? Is our ED seeing something? Indeed, are there any hospital admissions? So we're continually looking to check the validity of every single data set that we receive to make sure it's as accurate as we can get it.
And just a sort of follow-up from my previous question about travel, if you came from, say, a category 2 country and you flew into Southampton, say, which is currently category 3, you know, you transited from one airport, which is safe, one jurisdiction, you've gone to another, but you've only been in the terminal building and then you've come to Guernsey. It seems a bit unfair from people, but
Yeah.
what are the rules? What are you thinking about there?
So at the moment, the transit would be category 3, but as I say, we're continually looking at that information and getting information on the test of arrival and test on day 7. When we get further information on that, we'll be able to see how many of the infections were in fact acquired just before or during travel. I think that precise risk assessment of the travel process per se is yet to be clearly defined.
Okay, Marina.
With the self-swabs for test and arrival, I suppose how reliable, you know, how confident are you on their reliability and for people to, you know, properly carry it out, and actually what will people be doing with it?
Well, they'll be supervised, won't
Yeah.
they, Nikki?
Yeah. So, do you want-
No,
Yeah,
I'll probably think.
so it's a supervised self-swab, and so basically people will be swabbing their throat and then swabbing their nose. It'll be under supervised process, and the day 7 test will be an operator-taken swab. So it's a combination of the two. One of the reasons why we wanted to do that is we wanted to get and see how the supervised self-swab works. It gives a more rapid transit through the airport. So if you think about it, if you're going to have a whole lot of people crowded up in an airport during the winter season, that's not a good thing. So what we want to try and do is have a really efficient, smooth process where people go through, get a self-swab, either isolate till negative result, or in most cases it's going to be at least 7 days isolation, and then get their day 7 test, which will be an operator-taken swab. So it's a combination, it's a blend of the two, and it's trying to find something that is as safe as possible, but also is very slick and efficient.
Okay, Ewan.
Question for Mr. Whitfield. You talked about the hospitality sector needs protecting. What kind of long-term planning are we looking at? Not just financially, but how we can support them and the types of arrangements we can maybe come up with to get a bit of a tourist season next year?
I think, as has been demonstrated so far, I think it's very much of a movable feast. We can't predict totally when we're going to lift out of there, particularly in terms of, for the hospitality sector, when we're going to have more of a free flow of people that would come in and book the majority of bed spaces within the accommodation. I think also what's proven to be really difficult, and we've used assistance from an external body as well as ourselves working with industry reps, is the industry itself is very, very different. We've split it into 3 main category groups, but you've obviously got main 4-star type accommodation, you've got the small hotels, you've got self-catering, you've got those with restaurants, you've got those without restaurants, and so therefore we've had to categorize and place those against the star rating system dependent on their structure. So there's not a one-size-fits-all, so it's very difficult. It's not about competing and keeping our hospitality sector on revenues they may have generated at a very positive moment in time. It's supporting that industry, and of course we've put over another 2 million on top of the predicted figures in order to be able to support that industry to survive, and also that it stands up when we get that movement. I think the best way that we can cope for that is to continue to review in the step changes that we've done to date. And so we've just seen a combined system of both either payroll support or the grant based on that scale system I'm talking about, and we'll adopt that through the winter months and then review again where we are.
Okay, good. Time for one final question if anyone has one. Yeah, Marina.
Is there plans to kind of further regionalise the UK? Currently the region is quite large. And following on from that then, are you still relying, I suppose, on the trust of people? There's no other kind of way to truthfully find out where someone has been, and that's just a risk that I suppose you have to deal with to know where people have come from.
Do you mind dealing with the first? Well, do you deal with first both bits, and I'll add a comment at the end. Thanks.
So with regard to relying on the trust of people, yes, we are relying on people completing the travel declaration. But again, it's a legal document that you're completing. So I think that's really important. With regard to further regionalising the areas, we have had a look at that. And in fact, behind the data that we present each day, we have a heat map. So we actually have a look at the regions on the heat map. So we actually are aware that what's happening across a particular region, you know, what's red, what's closer to green. So we look at that on a daily basis or on a regular basis as well. One of the problems is that you can live in a very low prevalence area, drive into the city, work all day in a really high prevalence area, and then go back. And if that's your area of residence, if you do it by, well, your postcode of where you live, that might not be reflective of your true risk. So I think to answer your question, there is no perfect solution for this, and we're continually looking at it. But we think the best thing at the moment is to look at regions, but to always keep our minds open as to whether there is an improved solution. So we continually look at it, but we think that's probably the most appropriate at the moment, particularly with a rapidly evolving situation in the UK. Things are literally changing on a day-to-day basis. One of my ex-colleagues from University College was on the news this morning saying that 90% of the intensive care beds in his hospital are now taken up with COVID-19 patients. So it is a very rapidly evolving situation, and I think we have to be really careful how we classify our regions. So.
No, thank you very much. I mean, the segues into final comments from me, really, which I think are appropriate, which is this question of trust. I mean, it has been so critical, really, from moment one, in terms of the Guernsey Together message and people actually adhering to what was being asked of them. Yes, obviously, we've always had the regulations there to enforce, but we knew from the moment we locked down the community with 63,000 people and 135 policemen that it was never going to work unless people had confidence and understanding in what they were being asked to do. It's the same with this phase now as we move into it. It is about being able to explain in detail the rationale behind the regime, why the decisions have been reached in the way they have, so that people have confidence and are prepared to adhere to it. And that's why it is important that, notwithstanding what we've said today is actually not going to have very much practical effect, people can see the direction of travel and can start to be thinking about that, so they can start to be making informed choices, knowing what the impact of that will be if they do travel, how it will impact them if they want to return. So that's the way you build trust. That's the way you can then place reliance and confidence in the community. I think one of the things that has always impressed, I think, everybody is how nobody in the community wants to be the one who's responsible for bringing it back in to the rest of the community, and I think that is really important, and that is absolutely the embodiment of the Guernsey Together spirit, which is a very appropriate point at which I think to bring this particular media briefing to an end. So thank you very much indeed. Thank you.